This is One-on-One.
That's good acting, yeah.
I get that a lot. I go to Atlantic City all the time, like, are you the guy? I go, no, I'm not.
This is one you can't afford to miss.
They thought that I wouldn't survive it, but I knew I would.
Dr. Marianne Fonda is a professor in the Division of Nursing at Bloomfield College. Good to see you, Doctor.
Good to see you, Steve. Thanks for having me.
Now, come on, right out of the box, show me this. This is your, you got this when you graduated as a nurse.
This is my cap for my pinning ceremony. I won't say what year.
You don't have to.
But this identified me as a baccalaureate graduate of nursing. The public was able to recognize who was a nurse when they would be on the, in the hospital or in the community. You would wear this, and actually this is what it would look like.
How good does it, hey Steve, how good does that look? That looks great.
We've moved away from that. So we've moved a long way in nursing, from a cap to scrubs, and you know, because it's much more practical for infection control reasons. It's not practical to wear this anymore. But I did want to introduce
things in
with
perspective.
that because we have such a schizophrenic nature of education of nurses
What does that
today.
mean?
Well, there's many ways that a nurse can become a registered nurse. There's 4 ways to become educated as an RN, initial RN. You can go for a 4-year baccalaureate program, which is what I did. You can go 3 years to a diploma program. You can go 2 years to an associate degree program, or you can go to an accelerated from a non-nursing degree right into an RN program also. So there are many ways to achieve your registered nurse status in New Jersey and throughout the United States.
There's so many changes in the nursing field. What would you say the #1 challenge facing the field is today? Because for years we talk about the nursing shortage. First of all, as bad as it was, the nursing shortage.
Yes.
Is it still as bad?
The nursing shortage is still there, but I need to talk about that in terms of New Jersey.
Go ahead.
Because our graduates from Bloomfield College are all getting nursing jobs. But where are the jobs? They're not in the hospitals in
Where
New
are
Jersey.
they?
They're in the community, public health, and out of state. So many of our nurses are going to Texas, North Carolina, Florida, California, because they want acute care settings.
Is it because so many hospitals are closing in the area?
That has a lot to do with it. The closures. A lot of our nurses aren't retiring because of the economy. The average age of a nurse in New Jersey is 50.
Right.
And they're not retiring, not giving up these jobs, so the new graduates are not able to move into those positions.
So what are you saying to the new graduates at Bloomfield College?
Well, I think there has to be a paradigm shift from thinking that nursing is only in the hospital. It's not. Only 50% of New Jersey nurses, according to the New Jersey Collaborative out of Robert Wood Johnson 4 years ago, stated that 50% of nurses now work in the hospital. So where are the rest of them? They're in the community, they're in doctors' offices, they're in public health agencies, clinics. And as nurses, according to the Institute of Medicine, we're going to be leading the change. Nurses are going to lead the change of healthcare in the United States.
How so?
Advanced practice nurses are going to be taking the place or filling in gaps of care throughout New Jersey and the United States where there aren't family practitioners, they're not general practitioners to provide that care for our population in New Jersey.
The Robert Wood Johnson Foundation has done a lot of work in this. They've recently published a report. What are the findings in terms of the future of nursing?
Yeah. There's 4 main points that they brought out for the future of nursing, that nurses should be one of the leaders of change. And one of them, the first finding, is that nurses should practice to their utmost the capacity of their education. So if you are a master's graduate, you should be in a leadership position. You should be able to be affecting policy change.
Sure.
Not just giving out medications on a unit. So that's one big aspect of it, really working up to the capacity of your education. Second thing is seamless education. So these nurses who do not have bachelor's or master's degrees to go in those leadership positions should be able to get that education in New Jersey. And we've come a long way with that in New Jersey in the past 5 years. There are many master's and doctoral programs. There's 2 doctoral programs in New Jersey, but many master's programs that allow accelerated programs online, or there are 8 programs in New Jersey in place that you go on site to allow these nurses to get their graduate degrees
Sure.
to allow them to be leaders in the field. So that's the second thing, seamless education, to move nurses into graduate degrees, to put them as equal partners
And
with
Bloomfield's
physicians.
leading the way in that way as well.
Bloomfield is doing a wonderful job with, we have a wonderful undergraduate program, and the way we're leading the way in New Jersey, I think, is through our minority nurse push. We just received a $2.8 million PBI, predominantly black institution grant, and a lot of that is going to our nursing program, where we're updating our lab, we're starting nursing research, we're trying to attract minority nurses. We have a very large minority population at Bloomfield, but there's a disparity in the healthcare in New
Not enough.
Jersey. There's 17% Hispanics in New Jersey, and we only have 5% Hispanic nurses.
And
There's
Bloomfield's very
14
involved in trying to increase those numbers.
We are.
Go ahead, I'm
We're
sorry.
very involved in
A few
that.
seconds left. Go
And
ahead.
14% blacks in New Jersey, and we only have less than 5% black RNs in New Jersey. So we really are on the cutting edge with that and trying to improve that, pull together that disparity, eliminate that disparity.
Next time we come back, there's so many other issues we have to talk about. But I have to ask you, you've been a nurse for a few years. You absolutely love what you're doing?
Steve, I'm passionate about what I do. I absolutely am passionate. I was a clinical nurse for many years, and then I did some legal nurse consulting, but I came back as an educator because actually I'm one of the few people in nursing that has a doctorate, and I feel I owe it to my society to educate the next
You're a role model.